दान पखवाड़ा के उत्सव पर एकत्रित हुए हैं. A very good evening to all of you. Today, we have gathered on this platform to commemorate 40 years of the National Eye Donation Fortnight celebrations. Every year, we celebrate this occasion to honor our donor families, promote awareness about corneal transplantation in the community, and increase eye donation to fight corneal blindness. We greet our distinguished guests, members of the AIIMS family, our esteemed donor families, representatives of the partner eye banks, and NGOs involved in eye banking and corneal transplant, school children, and all our viewers and guests who have joined us online. I request our esteemed faculty members to kindly escort our honored guests to the stage. May I also invite our residents to present a green token of regard to our esteemed chief guests, Sri Lalit Vadvaji, Advisor Cost, National Program for Control of Blindness and Visual Impairment, Ministry of Health and Family Welfare, Government of India. Our guest of honor, Dr. Rajendra Joshi, Additional Director, DGHS, Ministry of Health and Family Welfare, Government of India, and our Director, Professor M. Srinivas. I also request our residents to kindly present the green tokens to our esteemed guests seated in the auditorium. May I now invite Professor Rajesh Sinha, Officer in Charge, National Eye Bank, to deliver the welcome remarks.
Thank you, Dr. Sridevi. Very good evening to all of you. I am Professor Rajesh Sinha, and I welcome you all in the 40th Eye Donation Fortnight celebrations hosted by National Eye Bank, RP Center, AIIMS. I would like to welcome the chief guest, Sri Lalit Vadvaji, Advisor Cost, National Program for Control of Blindness and Visual Impairment, Ministry of Health and Family Welfare, Government of India, for sparing his valuable time for this event. I welcome our guest of honor, Dr. Rajendra Joshi, Additional DGHS, Ministry of Health, Family Welfare, Government of India, for gracing the occasion. I welcome our Director, AIIMS, Professor M. Srinivas, who has always been very supportive and very helpful. We also have with us Professor Radhika Tandon, Chief of RP Center, Professor D.K. Sharma, Medical Superintendent of RP Center, Professor Namrata Sharma, Chairperson, National Eye Bank, Professor Tushar Agarwal, Co-Chairperson, National Eye Bank. I welcome other dignitaries who are honored guests like Mrs. Neeru Khera, Dr. Shintu Dumra, and guest faculty from AIIMS administration, senior ophthalmologists, cornea specialists, and friends. I also welcome Dr. Rishi Mohan, who is the director of MMI Tech. I welcome family of late Professor Supriyo Ghosh, who are also part of donor family, as the family had consented to donate eyes of late Professor Ghosh after his demise. I also welcome the donor families without whose contribution eye banking cannot become successful. अगर कहा जाए तो सबसे अधिक हम लोग उन परिवारों का स्वागत करते हैं जिन्होंने बहुत साहस से अपने दिवंगत प्रियजनों की आंखें दान की, जिनकी वजह से अनेकों लोगों को दृष्टि का अनमोल उपहार मिला. I welcome our partner eye banks and NGOs whose contribution in managing corneal blindness is immense especially the teams of DDU Hospital, GTB, LHMC, ESIC Faridabad, Shroff Charity Eye Hospital, Guru Nanak Eye Center, Shakti Eye Bank, Nirmaya Eye Bank, Saksham, Dadichi Dehadan Samiti, Swami Shivanand Memorial Institute, Lakshmi Narayan Temple Charitable Trust, Noida, and Bhor Living Humanly Foundation. I also welcome team of Delhi Ophthalmological Society, NOTO, and NPCB. I would also like to welcome team of ABPMJ, all the RPC staffs, resident doctors and faculty members, National Eye Bank technicians, EDCs and PCCs in this function. Thank you very much.
Thank you, sir. Let us officially begin today's program by lighting the ceremonial lamp and invoking the blessings of Lord Ganesha. I invite all the dignitaries on the dais to proceed for lamp lighting.
वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो साथी तुम्ही सहारे कोई ना अपना सिवा तुम्हारे। तुम्ही हो नैया तुम्ही खिवैया तुम्ही हो बंधु सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो। जो खिल सके ना वो फूल हम हैं तुम्हारे चरणों की धूल हम हैं। दया की दृष्टि सदा ही रखना तुम्ही हो बंधु सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो करता तुम्ही हो धरता तुम्ही हो बंधु सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो। कभी जो बहके कदम हमारे मिले आसरे हमें तुम्हारे सहारा बनके प्रभु जी आना। तुम्ही हो बंधु सखा तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही। बुरा कभी ना करे किसी का करे समादर प्रभु सभी का। सदा सहारा रहे तुम्हारा तभी मिलेगा हमें किनारा। तुम्ही हो माता पिता तुम्ही हो बंधु सखा तुम्ही हो।
Thank you for a melodious and auspicious beginning. I now invite Dr. D.K. Sharma, Medical Superintendent AIIMS, to address the gathering.
Good afternoon and greetings, distinguished dignitaries on the dais, esteemed colleagues from AIIMS and other hospitals, respected donor families and recipients, ladies and gentlemen. First of all, I would like to extend a warm welcome to all honored dignitaries and convey sincere thanks to the family of deceased donors who have come here and those who couldn't come here. I will be giving you a brief about Hospital Cornea Retrieval Program, HRCP, which is a network of 4 hospitals with AIIMS New Delhi in the center to support the mission of curing blindness. As we can see, we have a task force available 24/7 round the clock, comprising of scientists, patient care coordinators, and eye bank technicians. The leadership is provided by the medical director or superintendent of the concerned hospital, HOD forensic medicine, and HOD ophthalmology of all these hospitals. We have built an ecosystem for this purpose, comprising of cornea transplant system, and requisite policy framework for this purpose is provided by the Ministry of Health and Family Welfare and National Program for Control of Blindness and Visual Impairment, NPCBVI. I would like to proudly tell you, next please. No, before this. Okay. Well, our aim is to avoid any delays in corneal preservation. Here you can see the key functionaries of GTB hospital. We get a large number of young donors, primarily from unfortunate victims of road traffic accident. Here you can see the esteemed luminaries of DDU hospital. One of the key objectives in cornea retrieval program is to improve safety and efficacy. Here you can see the leadership of LHMC and associated hospitals. In HRCP, we facilitate accessibility to potential donors, and the key functionaries of ESI Hospital Faridabad, our 4th partner, is shown here. Lastly, I would like to proudly tell you that our hospital cornea retrieval program has contributed to nearly 85% of corneas donated to the National Eye Bank this year, and I am sure that with cooperation of all our associated hospitals and other organizations which are closely associated with us, we will be increasing this percentage still further. Thank you all.
Thank you, sir. I now request Professor Namrata Sharma, Chairperson, National Eye Bank, to present the annual report of the National Eye Bank.
Thank you, and respected dignitaries on the dais, Shri Lalit Wadhwaji, Dr. Rajendra Joshi, Dr. D.K. Sharma, Dr. Radhika Tandon, Dr. Tushar Agarwal, Dr. Rajesh Sinha, dignitaries of the dais, ladies and gentlemen. For me, it is an honor and a pleasure to be presenting before you the annual report of the National Eye Bank, which is in RP Center, AIIMS, New Delhi, All India Institute of Medical Sciences. So I'm presenting this on behalf of the entire National Eye Bank, and we are always grateful to Dr. M. Srinivas, Director AIIMS, who's been always very helpful and encouraging in all our endeavors. Professor Radhika Tandon, of course, who's the chief of RP Center, and whose efforts in taking the eye banking forward as it is today in RP Center are really overwhelming. Dr. Tushar Agarwal, the co-chairperson of the National Eye Bank, and Dr. Rajesh Sinha, the officer in charge of the National Eye Bank. Now, the NEB or the National Eye Bank is one of the first eye banks in India, established in 1965 and has served the country for the last 60 years. We are not only linked with the corneal transplantation program, but also training of manpower, collaboration with other agencies, research, and of course the awareness drive. So the elimination, the aim is elimination of the corneal blindness, and not only by treating it, but also by preventing it, so that the corneal blindness does not occur. As of now, as per the recent survey, which Dr. Praveen Vashisht has communicated to us, there are about 95 lakhs of the people who have corneal opacities, and about 15 lakhs are waiting for corneal transplants, or in 15 lakhs the corneal blindness can be ameliorated by corneal transplantation. Now, this is the staff at National Eye Bank. There's a team of 24 members who work day in and day out. It is like a 24/7 service for them, who are here and whose efforts have yielded the results that we have today about the National Eye Bank. And this is primarily all the people who help us 365 days, 24/7. So not only the National Eye Bank is concerned with donation and retrieval, but processing, transplantation, education and research as well, and also collaborating with all the other centers, all the other hospitals for ameliorating the corneal blindness. Now, as far as the corneal transplantation is concerned, we in 2024 we collected 1,931 eyes, and we transplanted 1,636 eyes. And so our collection was good, so was the tissue utilization. An important thing is that this tissue utilization is 84.7%, which, if you look at the national average, is only 50%. So we are way ahead of the national average, and this is mainly because of the technology, the techniques, the surgeons that we have here, and the processes that we follow in National Eye Bank, so that we get good quality donor corneas which are transplantable. So this is just to show the total corneal collection, 1931, out of which 1,611 corneas were obtained from the hospital cornea retrieval program, which is almost 70% of our eyes. Voluntary eye donation was less. We would like it to be more, and I'm sure with functions like this, with the celebration of the eye donation fortnight, the awareness would increase more and more. But I think it is very important कि जो ये eye donation fortnight है, हम वो केवल fortnight पे ही ना मनाएं, पर सारे साल fortnight की तरह ही इसको mission mode में run करें. Then only we can ameliorate corneal blindness. As far as the distribution of the donors is concerned, it is notable कि हमारे जितने भी donors थे वो 21 to 50 years age group में थे, यानी कि young donors थे जिन्होंने donate किया, और हम उनके बहुत आभारी हैं उनकी families के, जो कि सामने आए, आगे आए और उन्होंने gift of sight blind लोगों को दी. और जैसा कि पहले भी कहा कि जो हॉस्पिटल कॉर्निया रिट्रीवल प्रोग्राम है, जिसमें कि हम हॉस्पिटल में ही आई डोनेशन काउंसलर्स को प्लेस करते हैं, जब भी कोई डेथ होती है तो हमारे आई डोनेशन काउंसलर्स वहाँ जाके काउंसिल करते हैं रिलेटिव्स को कि वो आइज़ डोनेट कर दें. उस प्रोग्राम द्वारा हमें 83% हमारे डोनेशंस हुए, और बाकी हमें अपने कोलैबोरेटिव सेंटर्स या हॉस्पिटल से मिले या वॉलंटरी आई डोनेशन हुए. Somebody in the morning asked me what is the gender of the donors, and this is the gender of the donors. 25% are females and 75% are males. This could also be because of the fact that road traffic accidents are more, and we get more eyes from there, and that is why this gender difference is there. Like I said earlier कि road traffic accident और जो suicidal cases होते हैं उनमें हमें सबसे ज़्यादा they are the commonest causes of death, and सबसे ज़्यादा donor corneas हमें उन्हीं से मिलते हैं. As far as the utilization trends are concerned, we use a lot more eyes than the national average, which I have already told you. And for optical grafts, that means for visual rehabilitation, these are the figures that we've used, 942 for full thickness corneal transplants. For therapeutic keratoplasty, which means when it is not getting treated, the infection is not getting treated or there's a perforation, we use we used last year 1,188 corneas. And for more modern surgeries, that means layer by layer corneal transplantation, या जिसे हम कहते हैं कि हम पूरा कॉर्निया आजकल रिप्लेस नहीं करते, खाली जो डिजीज लेयर होती है उसको निकाल के हम हेल्दी लेयर लगा लेते हैं, तो वो वाले सर्जरीज भी हम कर रहे हैं और उससे हमारा जो एक कॉर्निया है वो मोर देन वन रेसिपिएंट में हम उसको यूज़ कर सकते हैं. अगर एक कोई डोनेट करे तो उसको हम 6 लोगों में यूज़ कर सकते हैं. तो वन डोनर कैन एक्चुअली चेंज द लाइव्स ऑफ 6 blind people who are corneally blind, not only those people but also their families, because whenever a person is there in the family who cannot see, it transmits to the whole family, not only to that person. तो जब भी हम कॉर्निया ब्लाइंडनेस को रिहैबिलिटेट करते हैं, हम पूरी फैमिली को ही रिहैबिलिटेट करते हैं. हमारे सबसे ज़्यादा कॉर्निया ट्रांसप्लांट्स होते हैं जब हम इन्फेक्शन को ट्रीट करते हैं. ये नेशनल एवरेज भी है और ये हमारा एवरेज भी है. तो इन्फेक्शन इज़ समथिंग विच कैन बी प्रिवेंटेड, तो हमें मेजर्स लेने चाहिए कि हम ये इन्फेक्शंस प्रिवेंट करें. These are the keratoplasty trends of RP Center, and like I said earlier that we are doing layer by layer transplantation also, and every year this is increasing. जो मॉडर्न टेक्निक्स हैं लेयर बाय लेयर सर्जरी की, जैसे डीसेक, डीमैक, इवन दीज हैव बीन इंक्रीजिंग इन द लास्ट 1 year. Then there are reasons why we don't utilize tissue, and these are the reasons. Basically, whenever there is a chance that infection may occur in the recipient, we don't use those corneas, and those corneas are used for medical research and for medical education. This is just to show the corneal registrations. In a year, if you see, we get close to 2,000 registrations. So every year we increase by almost 2,000, and that is why we need to increase our corneal transplants as well. And we do have a waiting list of patients which we need to relook at and rework, because some of these patients, they get also operated outside and they are not struck off from our waiting list. So I think Noto is doing a great job by putting a common waiting list so that one person doesn't get registered in one eye bank but in multiple eye banks, and then you really don't know if it is unique or not. Our ocular pharmacology department has been working very well and has been distributing media, corneal preservation media, and last year this was launched, the Extrasol, where the corneas can stay healthy and can be used even after 7 to 10 days of being in this media. And Professor Vel Pandian and his team, Dr. Nambarnita Haldar, have been working on this. And this has been distributed, 2,824 vials were distributed to 114 eye banks across 24 states. So National Eye Bank is not only helping the corneal blind here at RP Center, but also helping in indirect ways, helping other eye banks also across the country. We are also in collaboration with the eye banks, NGOs and the government hospitals. Our HCRP partners are DDU Hospital, GTB Hospital, LH Lady Harding and ESI Hospital. And we have NGOs like Saksham, Sight Savers, Dadiji Dedan Samiti, Lakshmi Narayan Temple Charitable Trust, Board Living Humanly Foundation. And then there are other eye banks who also give us tissues, like Shakti Eye Bank, which has been our major anchor for last many years, and I see that people from Shakti Eye Bank have come today also. Thank you so much for being here and for helping us, I think for more than 30 years now. Shroff Charitable Eye Hospital, Niramaya Eye Hospital, GTB Hospital and Guru Nanak Eye Bank. Philanthropy is something now we are beginning to explore, and we have Raymond Foundation, which is now supporting pediatric transplants and facilitating it. We've also obtained 23 cornea donors from the multi-organ donors from the Orbo, and this also adds to the number of the corneas that we retrieve. Apart from this, our facility that is Dr. Sujata Mohanty's facility that is on amniotic membrane graft is helping to procure the amniotic membrane which is done in a GMP facility accredited lab. It is transported and it is being used effectively across all the units in RP Center. National Eye Bank is also helping in education and training, and we do impart education and training to our residents, our fellows in corneal transplantation. Then across the country, we've trained 9 of the ophthalmologists in corneal transplantation from railways, from other government organizations, from Army Hospital, from other NGOs as well. We did do a eye donation counselor boot camp for training program and refreshing the knowledge of our eye donation counselors on 18th August this year. This helps to reorient them and refresh their knowledge. And then we also had the eye bank technicians retreat where the eye bank technicians are learning to give the pre-cut tissues not only to our operation theatre but also to other eye banks, which other eye banks in other hospitals, which the surgeons have been cutting, but now we are training our technicians also to cut this tissue. CME or training programs are continuing for our nursing officers because they are the first point of contact with the deceased, especially in the hospital cornea retrieval program, and they can help to help in the obtaining the consents for the eye donations. Now, as far as the promotional activities are concerned, the pledges program continues, and we had last year more than 1,000 plus pledges. Notable amongst them was in Kumbh Mela, where 500 pledges were obtained, and these are some of the pictures of the promotional activities. This is on the shuttle services of AIIMS that we had put these hoardings so that people are aware of eye donation. There was a walkathon which was done in collaboration with the Delhi Ophthalmological Society. Thanks to Professor Rajesh Sinha, the president, and Dr. Praful Maharana, the secretary, for organizing with the National Eye Bank. These are again some of the promotional activities. Then shot put competitions were held, again in an endeavor to promote the eye banking and the eye donation activities. Then today these children would be awarded, but we did have a painting competition for children in the various schools in the Delhi. And again, yesterday we had a public lecture for the promotion of eye donation as well. Online pledges are continuing. We do have on our own platform, and also Noto has its on the platform. Then again, these are voluntary eye donation pledges at various places which were taken on behalf of the National Eye Bank. And this is the picture of the Kumbh Mela, where 500 plus pledges had been taken. Then fostering innovations and research is again a function of the National Eye Bank, and this Professor Radhika Tandon did speak about it in the press conference today, that a drone-assisted corneal collection program is being floated with ICMR and Shroff Charitable Hospital, where the corneas were obtained from the from NCI Jhajjar and were in fact from Sonipat, and then were transplanted in RPC Center. Then this is regarding the inauguration of the eye bank facility at AIIMS Kalyani, where we continue to support our AIIMS and other government organizations for starting these facilities. And our own alumnus, Dr. Prabhakar, did the first penetrating keratoplasty and then the first DSEC in AIIMS Kalyani. We are working closely on the biosynthetic corneas because that is an option that should remain, and studies are going on this. We've already transplanted biosynthetic corneas in 70 plus eyes with more than 7 years follow-up, and the research is going on this as well as on keratoprosthesis, which is a non-human donor cornea alternative. And work is also being undertaken on bioengineered corneas with IIT Delhi and DHR under the leadership of Professor Radhika Tandon, where the corneas are being decellularized, especially those which are not suitable for keratoplasty, to make them suitable. These are some of our publications, landmark publications. And again, we were awarded for our pioneering work by the NOTO, where National Eye Bank RP Center was recognized in the government sector for doing tremendous work in the field of eye banking. And this happened last month. We have come up with this new logo of the National Eye Bank, and thanks to Professor Rajesh Sinha and Dr. Sridevi for this. And this is going to be launched, and because we are the National Eye Bank, so we encompass the whole country in it. And this is the new Standards Operating Procedure 2025, again, which has been worked upon, which has been revamped completely, and again, which is going to be launched. And again, thanks to Professor Rajesh Sinha, the officer in charge, National Eye Bank, as well as Professor Radhika Tandon, under whose leadership this has now got completed. Again, we cannot thank enough the staff at the National Eye Bank, and also all the donors who have helped National Eye Bank to grow in leaps and bounds year by year. And there is a long wait for many, but I'm sure so many of us are here for this common cause, and we will make a difference. The wait for especially our young donors is there and is long, and at least we should get off this emergency waiting list. And this is the editorial that was written a couple of years ago, Mission Possible, and the mission possible is that there should be no waiting for corneal transplants, and I think we all can make this happen. And again, thank you very much for your kind attention.
Thank you, ma'am, for providing us a comprehensive overview of the year gone by. I now invite Professor Radhika Tandon, Chief RP Center, to speak on this occasion.
Good afternoon, everybody. Namaste. Our director, Dr. Srinivas, had to go for an important meeting to Nirman Bhavan, so he has excused himself. But we're very grateful that he was able to spend time and be here at the beginning of the function. I will not speak long because you have had a nice opportunity to hear all my colleagues and see a good picture of what the eye bank is doing and what we are doing. A few things I'd like to say. One is that जैसे आपने खुद महसूस किया होगा कि जो जर्नी है नेत्रदान से लेके जो कॉर्निया ट्रांसप्लांट होता है और रोशनी और दृष्टि आने तक ये काफ़ी लंबा सफ़र है और एक तरह से सोचा जाए तो छोटा सफ़र भी माना जा सकता है पर इस जर्नी में बहुत सारे लोगों की सहूलियत है starting of course with the donor family, then the team, and फिर जो कॉर्निया आई बैंक में आता है फिर वहाँ पे उसको प्रोसेस किया जाता है फिर वो ट्रांसप्लांटेशन के लिए कॉर्नियल सर्जन के पास और फिर पेशेंट को और ओटी का सामान एट्सेट्रा एंड जो पूरा माहौल क्रिएट किया जाता है कि दैट कॉर्निया शुड बी सेफली ट्रांसप्लांटेड अ लॉट ऑफ पीपल आर इन्वॉल्व्ड अपार्ट फ्रॉम दैट ये जो एक्टिविटी है डोनेशन ये आपकी तरफ से आता है इट इज़ नॉट इन आवर कंट्रोल सो आज का दिन है कि हम अप्रिशिएट करें कि कितने सारे लोग आज यहाँ आए हैं और इनके पीछे कितने सारे लोग ऑलरेडी है जो आज नहीं आ पाए हैं पर उन्होंने आइज़ डोनेट करी है और किसी न किसी प्रकार से हमारी मदद करी है इस काम में दो तीन चीज़ें हम एम्स की तरफ से बताना चाहेंगे कि वी आर वेरी लकी दैट वी आर बिलोंगिंग टू दिस इंस्टीट्यूशन वी हैव लॉट ऑफ अपॉर्चुनिटीज़ टू टच लाइव्स वी हैव लॉट ऑफ अपॉर्चुनिटीज़ टू डू गुड and if we do our own work seriously, honestly and intelligently and enthusiastically, it can make a lot of difference. We get a lot of support from many people, including the administration. A simple example is the concept of eye donation counselors. When we were able to show that by having dedicated counselors who work well and who are given proper guidance, it makes a lot of difference under the hospital cornea retrieval program. But we used to depend on external agencies for this support. We have got support from NPCBVI also for counselors, but when we found that it was limiting our performance, then luckily the director and the whole administration of AIIMS said that we can give you patient care coordinators. And as it happens, I felt that maybe patient care coordinators is a better term rather than calling eye donation counselors or grief counselors. And so this was just by chance, having non-ophthalmologists, maybe non-medical people looking at a thing and they say, why are you calling them eye donation counselors? We'll give you patient care coordinators. So I thought that was good, and then we're hoping that some of the patient care coordinators who have got so much of experience and so much of knowledge, maybe they can work as patient care managers and help more people. Apart from that, I'd like to recognize all the work which all the residents do, because they're so busy that even now they're busy in the OT or they're in the casualty. They're always busy, and still they are taking time out to for going for voluntary calls, and it is difficult to manage everything. So the residents, the nursing staff, everybody. So I just wanted to indicate that it's a long journey as well as a very big team involved. From our side, I like to assure that we like to make sure that every cornea donated is transplanted in a suitable fashion. And also the recipients, a lot of support has come by having ABPMJ, because that has helped many people who would struggle with having the surgery. That has been a big support as well. So with that, I'd say that with all of yours contribution and motivation today, for your being here itself means a lot to us. We spent your time to come, and the activities that we do, we hope that through your presence and your message carried forward, this activity will be considered as a good cause. There's nothing wrong or illegal about it. It happens after death. It's very transparent, and everything is done in a very proper way. Nothing to be worried about, and we have so many families here who've already done it. इतने सारे लोग आए हैं, आपके हम बहुत आभारी हैं कि आपने नेत्रदान किया है, और कितने लोग हैं जिन्होंने इस काम को आगे बढ़ाया है. So with that, I'll finish here, and thank you for the opportunity.
Thank you, ma'am. We now have a short movie on the National Eye Bank, providing an insight into its workings, right from counseling of the donor families, tissue procurement, processing, and surgical trainings of doctors to ensure optimal utilizations.
वार्डन काका, रंग कितने रंग के होते हैं?
लाल, नीला, पीला, हरा.
हरा कैसा होता है?
अब कैसे?
National Eye Bank, Dr. Rajendra Prasad Center for Ophthalmic Sciences, All India Institute of Medical Sciences, New Delhi, was established in 1965. It is one of the oldest eye banks in India and has brought the gift of sight to thousands of blind people free of cost. The newly renovated National Eye Bank was inaugurated by His Holiness the Dalai Lama on the 10th of March 2013 and is equipped with state-of-the-art facilities. The bank's mission is restoration of sight to the corneal blind, promotion of eye donation activities, corneal transplantation, education and training of paramedical and medical workers, and research in the field of eye banking.
आपकी इच्छा है मरी के बाद आपकी लेनी है, तो हमारे पास ये प्लेटफॉर्म है.
It conducts workshops for medical, paramedical staff and general public to make them aware of the benefits of eye donation. The functions of the eye bank include collection of donor eyes, tissue retrieval and processing, followed by tissue evaluation and distribution. It also performs training and teaching of residents, doctors and eye bank personnel, When the family of the deceased approaches the eye bank telephonically, the team of doctors and technicians reach the residence of the deceased at the earliest to retrieve the eyes. In the early years, the National Eye Bank was dependent on voluntary donations received through telephone calls. However, in recent years, with the collaboration with NGOs and government hospitals, the focus has shifted to the Hospital Cornea Retrieval Program, which has boosted the cornea collection program. The program consists of special eye donation counselors who are posted at various strategic locations like Trauma Center, AIIMS Mortuary, New Emergency Ward, and intensive care units to keep a track of possible eye donations at these high mortality areas.
मेरे बच्चे की दिक्कत पुतली की दिक्कत हुई थी, डॉक्टर ने एडवाइस किया है कि जब भी आ जाएगी जल्दी जल्दी उसकी पुतली चेंज कर दें। मैं उम्मीद करता हूँ कि जल्दी मेरे बच्चे की पुतली चेंज हो जाए, इससे ज़िंदगी सही से सुचारू रूप से चल सके।
The National Eye Bank is a pioneer in various research activities related to eye banking. The National Eye Bank was the first eye bank to supply McCarrick-Kaufman media, which is the most commonly used preservative media for preservation of donor cornea. It supplies McCarrick-Kaufman media to various eye banks all over India. The bank has trained the largest number of corneal transplant surgeons in India who have carried the mission of eliminating corneal blindness across India. The National Eye Bank is a pioneer in the development of various surgical techniques and innovations in corneal transplantation, which are customized for developing countries such as ours. Pre-cut tissues for lamellar corneal transplantation is being supplied to various government organizations, which has allowed optimal use of donor tissues such that the tissue obtained from a single donor tissue can be transplanted to multiple recipients.
I hope you all enjoyed the movie. I now request our guest of honor, Dr. Rajendra Joshi, Additional Director, DGHS, Ministry of Health and Family Welfare, Government of India, to deliver his address on this occasion.
सबको मेरा नमस्कार, respected dignitaries on the dais and off the dais, and most importantly, the donor families and all the people who are supporting this eye donation movement. And when I say all, it is such a big number. We have got community people who help us in creating awareness. We have got NGOs, we have got trusts, we have got our nurses, counselors, and of course doctors. See, you are all those who are consented to donate the eyes of our near ones when they die. You are the real heroes. So my main thing, request to all those who have gathered here and those who have joined online is that all of us should try to keep this in mind and try to create awareness. Awareness about two things. One is, of course, eye donation. Whenever our friend, relative, we come to know that he has demised, we should try to talk to the family, we should try to motivate. There is another awareness, that is prevention. See, cornea is the glass-like transparent thing in front part of the eye. So being in the front, it is exposed to injuries, it is exposed to infections, and it is also dependent on vitamin A. In the early 80s, when I started my medical journey, we used to see a lot of vitamin A deficiency, blindness in children, just for the lack of awareness. Of course, fortunately, thanks to more awareness in the community and vitamin A supplementation program, now we hardly see it. But even as recent as 2025, when I go to field, I meet children, young children who had minor corneal injury but was not taken to appropriate ophthalmic care immediately, which got infected, which resulted in corneal blindness. So there are a lot of preventable things which all of us should try to learn about and spread awareness. And also we should motivate people to become eye donors, but more importantly, to motivate whenever any death occurs, whether it is at home or at hospital. The National Program for Control of Blindness and Visual Impairment by Government of India was started way back in 1976 and achieved a lot in terms of cataract surgeries, in terms of corneal transplantation, in terms of infrastructure development by establishing Regional Institute of Ophthalmology in many states, and AIIMS was the first RI board which was started by Government of India. It is the Apex Institute which is helping the program not only by conducting the maximum number of corneal transplants, but also handholding and training other center specialists, the skill building, which is very, very important. Those who have got trained here, they will go to respective institutes or states and train others. So we want to have a cascading effect. And I must congratulate the whole team here and the National Eye Bank and all those involved, because in terms of quality, in terms of optimum utilization, AIIMS remains the best in whole India. From the ministry side, we are actively in contact with the NOTO, which is for all organ transplants. Of course, cornea is also one of the organs. So we want to make things more transparent so that whenever there is a donor, recipient is connected. So we have developed some SOPs for who should be given priority, how to connect, how to contact. Otherwise, I will have a blind child, 4 years, 6 years in a village, and he doesn't know when there is a cornea available. And fortunately, compared to other organs, cornea has got some more advantages in terms of transplanting. But still there is a real need for communication with the recipient. And also we are looking at how to follow up, make a registry. I'm sure all the NGOs, trusts and hospitals involved will cooperate with us in this endeavor. Lastly, but again most importantly, please take care of your eyes. Any doubt, any injury or infection or even a doubt, please contact ophthalmologist and do whatever is necessary. Eyes are very precious, and only those who suffer from loss of vision, they know the importance. And nowadays we are seeing a lot of diabetic retinopathy, hypertensive retinopathy, things which are going bad, which could have been avoided by good control of diabetes, by regular checks. And in early stages, for everything there is very good treatment. But if I go very late, then there is very little the doctor can do. So with that, I again congratulate AIIMS and all of you for sparing your time and in this very, very important initiative, giving support for the program. Thank you all.
Thank you, sir. May I invite the Chairperson, National Eye Bank, Dr. Namrata Sharma, to present a plaque to Dr. Rajendra Joshi as a token of our appreciation. We are pleased to share that a brand new National Eye Bank logo has been designed, along with the revised standard operating procedure, a comprehensive manual to ensure safe, uniform, and high-quality eye banking practices. I request our chief guests and the dignitaries on the dais to kindly come forward for the launch of the logo and the SOP. Thank you all. I now request our esteemed chief guest, Sri Lalit Vadhvaji, Advisor Cost, National Program for Control of Blindness and Visual Impairment, Ministry of Health and Family Welfare, Government of India, to deliver his address on this occasion.
Good afternoon. Honorable dignitaries, Dr. Sharma, Dr. Joshi, Professor Namrata, Professor Tandon, and Professor Agarwal. Of course, our esteemed guests, the donor families, and the awardees, and all those healthcare professionals who are helping us in doing this noble job. I welcome you all in this August gathering. It is both an honor and privilege to stand before you today on this significant occasion of the 40th National Eye Donation Fortnight being organized under the National Program for Control of Blindness and Visual Impairment. Today we have gathered not only to celebrate the spirit of selfless giving, but also to renew our collective commitment to eradicate the preventable blindness from our society. We often take the gift of sight for granted, yet for millions across our country, the world remains a place of darkness and uncertainty. With over 12 million people in our country suffering from some kind of blindness or visual impairment, this is not just a medical issue, it is a human challenge. The good news is that blindness is often preventable, or it can be treated, and one of the most powerful ways to restore vision is through eye donation. The cornea from a single donor, as we know, can restore the sight of 2 individuals. A miracle that has been made possible by one of our generous decisions and of course carried forward by our people who are working here relentlessly. Every day we witness a life-changing act of kindness. Eye donation is one of that act. Quite noble and immensely impactful, it offers the gift of independence, dignity, and opportunity to those living with corneal blindness. Yet, the demand always overweights the supply. Despite medical advancement, we face a shortage of donated cornea. This gap can only be bridged or filled by raising awareness and by motivating more people to pledge their eyes. The Eye Donation Fortnight is a national initiative aimed towards raising this awareness, discrediting myths, and encouraging our pledges. These 15 days observed across the country from 25th August to 8th of September are a beacon of hope for thousands waiting for the light of vision. We must act not just by pledging ourselves, but by educating others, challenging misconceptions, and celebrating the humanitarian essence of eye donation. It's very simple, safe, and it transcends religious, cultural, and social boundaries. To talk about the achievements of this program was launched in 1976 and reframed in 2017, and the objective is to reduce the blindness prevalence from 1.4% in 1970 to 0.36 by 2020, and with a target to achieve 0.25% by the end of this year. It ensures accessible, affordable, and quality eye care with primary eye service at Ayushman Arogya Mandir to tertiary care at regional institutes of ophthalmology. The focus remains on prevention of cataract, refractive errors, and corneal blindness. With the rise in corneal opacity, especially among 50+ and youth demographies, the need for viable cornea has increased dramatically. Through partnership with institutions like Dr. RP Center, AIIMS, we have developed the indigenous cornea storage medium, now supplied to over 125 government eye banks, significantly increasing both collection and transplant numbers. I extend heartfelt thanks to RP Center AIIMS for their unwavering support to the NPCBI at Ministry of Health and Family Welfare. I also congratulate every individual, family members, and health workers involved in promoting eye donation. Your efforts are transforming life across the country. Let us also celebrate India's declaration as a trachoma-free nation by WHO, an achievement driven by inclusive quality eye care and relentless dedication of our healthcare workers. As we move towards Viksit Bharat, we are committed to revamp NPCBI to become more comprehensive, inclusive, and technology-driven, ensuring we tackle the root cause of visual impairment in India. Let us remember that every eye donated can live 2 lives. Each one of us has a power to reason something seems sunrise again. So we can pledge our eyes, speak about the eye donation, educate others, encourage others, and help break the myths behind not donating the eyes. We have to be a part of change. So in concluding remarks, I'll express my deepest gratitude to everyone who put in their relentless effort to make this event possible. Your dedication is not only valued, it is vital. Together, let's try to eradicate preventable blindness and build a nation where no one is left in the dark. Jai Hind.
Thank you, sir, for those very inspiring words. As a mark of our gratitude, we would like to present this plaque. May I invite Professor Radhika Tandon, Chief RP Center, to kindly do the honors. We now move on to a very special and meaningful part of today's ceremony, honoring our donor families. I request Dr. Anu Malik, my colleague, to take us forward with this segment of the program.
Good evening everyone. मैं डॉक्टर अनु मलिक आप सभी सम्मानित अतिथियों का इस पावन अवसर पर सादर अभिनंदन करती हूँ। आई डोनेशन ड्राइव और आई बैंकिंग की नींव वो महान लोग हैं जो अपनी नेत्र दान कर जाते हैं। नेत्रदान महादान, आज का ये अवसर सही मायने में इन्हीं महान लोगों को सम्मानित करने के लिए है। वास्तव में नेत्रदान महादान एक संदेश नहीं बल्कि मानवता की सेवा का अनुपम उदाहरण है। आज का ये पावन अवसर इन सभी दिवंगत नेत्रदाताओं को श्रद्धांजलि अर्पित करने और इनके परिवारजनों को कृतज्ञता प्रकट करने का अवसर है। मैं मंच पर विराजमान सभी सम्मानित अतिथिगणों को सादर आग्रह करती हूँ
कि वे कृपया आगे आएं और इन परिजनों को सम्मानित करें। समाज में नेत्रदान के महत्व को अधिक प्रेरणादायक बनाएं। I now invite the family of late Professor Supriyo Ghosh sir Professor Supriyo Ghosh was the former chief of RP Center AIIMS. I now invite the family of late Mr. Ayush Kumar. Family of late Mrs. Ramrati Gupta. Family of late Shri Roshan Lal Gupta. Family of late Shri Kanhaiya Lal Mendiratta. Family of late Shri Mulak Rajji. Family of late Shrimati Lakshmi Devi Popli. Family of late Mr. Ayush Kumar. Family of late Mr. Shiv Shankar. Family of late Mr. Kailash Sani. Family of late Mrs. Radha Devi. Family of late Dr. P.C. Shukla. Family of late Mrs. Surinder Kaur. Family of late Mrs. Ranjit Kaur. Family of late Mr. Rohit Kumar. Family of late Miss Drishti Kumari. Family of late Mr. Puran. Family of late Mr. Saurabh. Family of late Mr. Dheeraj. Family of late Miss Sonakshi. Family of late Miss Shivani Kumari. Family of late Mr. Jeetu Yadav. Family of late Mrs. Rambati. Family of late Srimati Sunita Dhingra. इस अवसर के लिए आज हमारे साथ जुड़ने के लिए आप सभी डोनर फैमिलीज को धन्यवाद। आपके प्रियजन का नेत्रदान किसी के लिए नया जीवन बना है। आपके द्वारा किया गया नेत्रदान अमूल्य है, जिसने किसी जरूरतमंद को देखने का सुख दिया है। इस मानवता के लिए हृदय से धन्यवाद।
Thank you, Dr. Anu. We now move on to a very important part of our ceremony, awarding and honoring our residents, staff and partners. I request Dr. Pranita Sahai to take us forward through with this segment.
Good evening, everyone. It is my privilege and honor to proceed with the award and felicitation ceremony as a part of the National Eye Donation Fortnight celebration here at AIIMS. This fortnight is just not a celebration, it's a reaffirmation of our commitment with the noble cause of eye donation. It is a moment to honor the dedication of the entire team. At the outset, I extend a heartfelt gratitude to all the doctors, nurse, technicians, drivers, support staff, NGOs and partner institutions. Each of you, in your unique way, have carried forward the light of vision and the gift of sight. Today, we celebrate your unwavering dedication. We begin with recognizing the support of our senior residents who are the backbone of our keratoplasty services here at RP Center. For the awards of the senior resident, I would like to request Dr. Ananya, our senior resident at RP Center, to announce their names.
Thank you, ma'am. I would like to call upon on stage Dr. Venkatesh Antalmarath, Senior Resident Unit 3. Dr. Himanshu Khandelwal, Senior Resident Unit 4. And Dr. Abhishek Kumar, Senior Resident Unit 6. Their surgical skill and compassionate care have restored vision and transformed lives. Please join me in congratulating them with a big round of applause.
Next, we would like to honor Ms. Ria, Nursing Officer, for assisting the highest number of keratoplasties here at RP Center. The role of nursing staff is equally important. They spend hours in our OT to ensure that everything is in place and the surgeons are comfortable for the best outcome. So please give her a huge round of applause for assisting the highest number of keratoplasties in RP Center in the past year. Next, we would like to honor Mr. Vikas, our driver at RP Center, for the maximum number of cornea calls attended by a driver. The support by the transport team is stupendous in ensuring the timely retrieval, which is of paramount importance in maintaining the quality of the harvested tissue. Your behind-the-scenes dedication makes these life-changing surgeries possible. Thank you. The fight against corneal blindness is a collaborative effort, and today we honor our partner institutions and NGOs who stand shoulder to shoulder with us. We recognize the contributions of our partner institutions, and first I would like to call upon the team of Deen Dayal Upadhyay Hospital, Delhi, for which we have Dr. Amit Mehta, Dr. Shefali Manocha, Dr. M. Das and Dr. Yogita to receive the felicitation award for DDU Hospital. Next, I would like to welcome on stage the team from UCMS and GTB Hospital, wherein Dr. Ekta Sen has joined us today for the felicitation award for UCMS and GTB Hospital. We receive innumerable corneas from GTB hospitals, and they have a very high collection at their hospital and mortuaries. Next, we would like to felicitate the team of Lady Hardinge Medical College and Associated Hospitals. We have Dr. Piyush Ramawat sir and Dr. Prachi who will be taking the award for Lady Hardinge Medical College. Sir, we welcome you on the stage. Next, I would like to welcome the team from Shakti Eye Bank with Mr. M.L. Arora, sir, the President of Shakti Eye Bank, and Jaswant ji, who have joined today for receiving the felicitation award for Shakti Eye Bank. They have been the partners in association with the National Eye Bank for the longest time, and we have received huge contributions from them. Thank you, sir, for your support to the National Eye Bank. Next, we would like to welcome the team from Dr. Shroff Charity Eye Hospital, and we have Mrs. Raki Natawat from Shroff Charity Eye Center for receiving the felicitation award. The Shroff Charity Eye Center has a huge transplant program that they run for their own selves, and other than that, they also keep supporting others, the other transplant centers with the tissues that they collect. That's a huge help that they provide to the other institutions despite of themselves running a transplant program at their own hospital. Niramya Eye Bank could not join us today. Next, we would like to facilitate Guru Nanak Eye Bank, and we have Mr. Shailendra Tripathi and Rakhi Verma to receive the award on behalf of Guru Nanak Eye Bank. Next, we would like to welcome on stage the team from Saksham Eye Bank, wherein we have Mr. Lalitji Devendraji to receive the felicitation award. We welcome you, sir, on the stage. The team of Saksham is just not helping us with the retrievals, but also in promoting the eye donation awareness programs that you can see in the pictures. They routinely conduct various activities to promote eye donation at their own level in their organization. Next, we would like to welcome on stage the Dichi Deda Samiti, wherein Mr. Vishal Chadda, the General Secretary, and Mrs. Manju Prabha, the Vice President, have joined us today to receive the felicitation award. The Dichi Dedan Samiti has been constantly involved in the eye donation awareness activities and have helped in retrievals, not just in National Eye Bank, but various other eye banks as well. And they have been continuously working all across Delhi in helping increase the number of eye retrievals. Please give them a huge round of applause. Next, we have with us the team from Swami Shivnandan Memorial Institute, wherein Ms. Sunita Bhasin, Arshadji and Arshadji have joined today for the felicitation award. The team of Swami Shivnandan Memorial Institute, they again have not just helped with the retrievals, they conduct various drawing competitions. We have had drawing competitions at their schools as well for promoting the awareness activities. And we have students from their organization here today to receive awards as well, and they are seated here in the audience. So give them a huge round of applause. Next, I would like to welcome the team from Lakshmi Narayan Temple Charitable Trust, Noida, Mr. A.K. Gupta, Mr. O.P. Goyal, Mr. R.K. Bhatt, Abhishek Ji and Poonam Gupta for receiving the felicitation award for their contributions towards National Eye Bank and eye retrievals in our country. It is huge when a spiritual organization joins with us and helps at the level of community to help improve eye donations, because it does make a huge impact when these organizations get attached in such a noble cause. So please give them a huge round of applause. Next, we would like to welcome on stage the Bhor Living Humanly Foundation, wherein Professor Sumita Jetli and Ashutosh Verma have joined in to receive the felicitation award from National Eye Bank today. So, Bhor Living Humanly Foundation are routinely organizing eye donation awareness activities across all of Delhi University, colleges and schools, and they're doing a huge, very good and noble cause in increasing the awareness in our society for eye donation, which is something which is very important for us. Next, I would like to welcome the team from Delhi Ophthalmological Society, our President, Dr. Rajendra sir, and Secretary, Professor Dr. Prafulla Marana sir, for receiving the Felicitation Award on behalf of National Eye Bank for their support to the various awareness activities of National Eye Bank. Every year, the Delhi Ophthalmological Society conducts the eye donation walk and various other activities to promote eye donation. We would now like to welcome the team from Noto, and we have Dr. Kanika Rastogi and Prerna ji to receive the award from the team of Noto for their contributions towards organ transplant and eye donation. Please give them a huge round of applause. Noto has been a huge support to not just eye donation but to various organ donations and organ transplant, and they're doing a very noble job. Next, we would like to call upon the team from ESI Faridabad, Dr. Shachi Srivastav and Dr. Vinay Arora sir, who have joined us now for receiving their Felicitation Award and for their support to our National Eye Bank. Each of these institutions embodies the spirit of service, and their partnership strengthens our mission of eye donation and corneal transplant. So please give a huge round of applause to all these partner NGOs and organizations who have helped us in increasing awareness and increasing the retrievals. Now, a special word of appreciation goes to various departments and individuals within AIIMS New Delhi who support the noble cause of eye donation. We would like to call upon the team from AIIMS Mortuary and the Trauma Mortuary, wherein we have Dr. Vanshika and Dr. Anupriya, who are here to receive the award on behalf of AIIMS Mortuary. So every year we have a huge number of collections that we receive from the AIIMS Mortuary itself and the main mortuary, and the motivation to the family members of the deceased is primarily done by the first point of contact, that is the doctors working there and our patient counselors who in time counsel these deceased families who are not in a very good state of mind, but the motivation given by them results in increase in the number of transplants that are ultimately done in our hospital. Next, we would like to felicitate the Organ Retrieval and Banking Organization today for helping us and supporting us in the eye donation activities here at RP Center. And the ORBO has been a constant support, not just for the in the eye retrievals and eye donations, but they also help us in providing amniotic membrane grafts, which is something very important in the management of patients with corneal pathologies, and they provide us with round-the-clock services of providing amniotic membrane grafts. Next, I would like to welcome on stage the team of AIIMS Kalyani, Dr. Mahua Chattopadhyay, Dr. Prabhakar Singh, and Dr. Chitra Sarkar. Dr. Namrata has already highlighted that with the collaboration, the AIIMS Kalyani team has already started the cornea transplant facilities there in their organization, and we look forward to a future collaboration with them. We welcome Dr. Mahua Chattopadhyay, who is the head of the department there in AIIMS Kalyani. Please give her a huge round of applause for taking across the cause of eye corneal transplants in a new organization, which is not very easy to do. Next, we would like to felicitate the team of Police Post AIIMS Trauma Center, and we have SI Ashok and SI Tarif Singh ji here to receive the Felicitation Award. So the role of the police is also very important, because a lot of time we have deceased who are road traffic accident patients, and we need clearance from the police. And time, as you know, is very crucial in retrievals, and the timely clearance from the police team helps us in the timely retrievals and getting us good quality donor tissues that can be transplanted to patients. Please give them a huge round of applause. The team of Police Post Main AIIMS, here we have SI Dipender ji to receive the Felicitation Award. They also have been constantly helping us here in the eye retrievals. Okay. Next, we would like to felicitate Mrs. Meera Kar, Nursing Superintendent, if she has arrived. Yes, we have Mrs. Meera Kar, Nursing Superintendent at RP Center. As we already discussed, the role of nursing staff is of paramount importance. They not only assist us in surgeries, but ensure that everything is functioning smooth in the eye bank, in the OT, and with the patient care facility in the wards. And here we have Mrs. Meera Kar. And we also have Mrs. Nirmala Jacintan Kujor and Mr. Galvin, the senior administrative officers in RP Center. I would like to request them to please join us on the stage for the felicitation award. The role of the administrative staff is also very important. They ensure that the patient care facilities is maintained well here in the hospital. Next, I would like to welcome Dr. Khalid Mahmood, Assistant Professor of Hospital Administration at RP Center. Sir is always there to help us if there is any issue with any patient or any problem. He is always there to help us round the clock. Dr. Khalid Mahmood, sir. Next, we would like to welcome on stage the APMJ team from RP Center. The introduction of the Ayushman Bharat has been of great help to the poor patients who cannot afford surgeries, and with the help of APMJ, all the surgeries of the patients who are covered with this APMJ are done free of cost, and that's the picture of the Ayushman Bharat team who is working round the clock at RP Center to facilitate patients' care in RP Center. Next, I would like to welcome the RAMED Foundation team at AIIMS, Dr. Tarsan K. Ruby, who's the founder, trustee, and chair, who's been helping us with the eye donation and transplant services. So, sir has been kind enough to make donations to the National Eye Bank and felicitating corneal transplant to patients who are in need for their care. Please give him a huge round of applause. The RAMED Foundation. We request sir to continue his support in future as well. So next, I would like to request the team of the patient care counselors at National Eye Bank to please come and join us on stage. The role of counselors, we all know, is crucial because the patients, the deceased family is often under stress, and the counseling, the way the communication is done with these family is ultimately what decides whether they decide and choose to donate or not. So we need to really congratulate and appreciate the effort of these counselors who work round the clock at various hospitals, who are in collaboration with the National Eye Bank and help us in increasing the number of eye donations and making every donation count, because next I would like to call upon the backbone of this program and the eye donation activities in RP Center, the team of the National Eye Bank, the staff who are working in the National Eye Bank 24/7, receiving calls on phone, coordinating with the technicians and doctors in ensuring a timely retrieval and safeguarding the tissues, making sure that the tissues are evaluated in time and distributed in time. We have the entire team headed by Mr. Dheeraj Mohania sir and Kamlesh sister and Anuji and all the technicians. So this team is really important for not just the eye donation but also conducting the program today. And you see a very well conducted program thanks to the team of National Eye Bank for putting in everything together, bringing in the donor families, the partner organization. Please give them a huge round of applause. Your dedication ensures that every donated eye finds its way to someone waiting for light. Thank you everyone who has helped. And next we will move on to the awards for the drawing competitions which has been conducted under the aegis of National Eye Bank to increase the eye donation awareness among the community. Through the colors and creativities, young minds remind us that eye donation is not just a medical science, it's a human kindness. So first of all, I would like to welcome the team from SSMI, and the drawing competition was held there, and the first prize goes to Miss Aksha, who's from class 5B and has drawn beautiful drawings there. So please give a huge round of applause to these students who've made beautiful paintings to increase eye donation awareness. We have first prize is Miss Aksha, second prize Miss Janab from class 9. You can see these smiling faces and young kids. I think they themselves are a motivation that we make an effort on our part to increase the eye donation awareness to the places that we belong to. Next, I would like to call upon the team from SSMI, who has also conducted a pot making competition. So the beautiful pots that was given to the guests today here were all painted by these students. So the first prize for pot making competition to SSMI goes to Preeti. She's from class 8 and she's here to receive the award here. Second prize goes to Kajal and third prize goes to Anmol. Please join us on stage for your awards. So don't look at their age and their height. The message that they have conveyed with these pots and beautiful messages is something which is beyond their age and something needs to be, that we need to spread across our societies. Next we have the team from Kan Darshan Darbar School for drawing competition. We have Mr. Yashraj, who's here. Mr. Yashraj. Mr. Yashraj is here? Okay. Next we Miss Ruksar and Lamya Gogna. So second prize goes to Miss Ruksar and third prize goes to Lamya Gogna. And they are from Kan Darshan Darbar School, and there was a beautiful drawing competition, and you can look at the beautiful posters that they have made with wonderful messages being conveyed through those posters. Please give them a huge round of applause for the efforts that they have made for increasing the eye donation awareness during this eye donation fortnight that we are celebrating here today. Next, I would like to welcome the team from New Happy School, wherein again a drawing competition was done, and we have Narayan Singh, Mishti and Gunjan. That is the first, second and third prize. And again, you can look at the beautiful posters that they made during the competition and the happy faces displaying the posters that they made during the competition. Please give them a huge round of applause, and their parents have also joined us today on stage. They must be feeling proud of their kids. So with this, we come to a conclusion of the award ceremony, and I extend my heartfelt congratulations to all the awardees and my deepest gratitude to everyone who has supported this mission. Together, we are not just restoring sight, but we are restoring lives. Thank you.
Thank you, Dr. Pranita. I now invite Professor Tushar Agarwal, Co-Chairman, National Eye Bank, to deliver the vote of thanks.
Good evening, everyone. Our chief guest, Shri Lalit Wadhwa, Advisor NPCB, Dr. Rajendra Joshi, Additional DGHS, Ministry of Health and Family Welfare, Dr. Radhika Tandon, Chief RP Center, Dr. DK Sharma, MS RP Center, Professor Namrata Sharma, and Professor Rajesh Sinha. All our esteemed guests and attendees, I'd like to thank our chief guest and our guest of honor for taking out the time from their busy schedule to be with us here today. We thank you for your time and presence and encouraging words. I thank our Director, Chief RP Center and Chairperson, National Eye Bank for this celebration today. On behalf of the National Eye Bank, we extend our gratitude to the leadership of the government organizations, NPCB, the Ministry of Health and NOTO. We thank all our partner organizations, the government hospitals and the NGOs who have graciously come here today to be with us today. We extend our heartfelt gratitude to the DOS for supporting our initiatives for the promotion of eye donation activities. We acknowledge all departments who have helped us in the function today, including the horticulture, housekeeping, audiovisual, and the engineering sections. A special thank to the AIIMS Mortuary Management and Staff, AIIMS Trauma Center, Orbo, our residents, dedicated volunteers, and staff members. Your tireless efforts and unwavering dedication have been instrumental in visually rehabilitating the corneal blind patients. और आखिर में वो सब परिवार जिन्होंने अपने परिजनों की आंखें दान करके कई लोगों को एक अमूल्य उपहार दिया. Let us carry forward the spirit of this event by continuing to promote awareness about eye donation and pledge to support the corneal transplantation program not only in this fortnight but throughout the year. Thank you. Thank you.
Thank you, sir. I now request you all to stand for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
With this, we conclude today's program. I request you all to join us for refreshments outside. The refreshments have been kept in the first floor, in the foyer. Greenfield Public School. I request the winners to come to the stage. I request you all to give them a huge round of applause. First prize goes to Divija Virat, class 8E, and second prize goes to Anjali Kumari, class 12C. Congratulations to the winners.
And we also have the pot making competition winner, Miss Radhika from class 9.
कमलेश जी ये है दीदी